So we're glad that you've chosen to have a breast surgery with us, whether it's a breast augmentation or a breast lift or a breast reduction. It's very important that you follow our instructions in the healing process. So whenever there's incisions that are made on the skin, it's super important that you're making sure that you're eating 100 grams of protein on a daily basis. We really want you to be eating that protein for the 6 weeks as the incisions are healing. Any of the dressings that we've placed on your incisions, please keep them on until we say otherwise or we take them off. Do not take off any of the dressings until we have evaluated you. There's a reason why we keep those dressings on, and even if they get a little bit soaked with some fluid, please keep them on, and we're gonna help you through that process. At first, if you do get implants, it's very important to know that oftentimes the implants do sit a little bit high, and so we often get questions about how long are they gonna sit high on the chest, and it just depends. Each patient's a little bit different, but it can be anywhere from 1 to 2 months, even up to 6 to 8 months, depending on the size of the implants, the patient's breast structure, and so on. We will encourage you to do massages of the breast, and we'll talk to you all about that. We'll even give you a video that explains how to do breast massages after a surgery. But we do want you to make sure that you understand that the things that are really important post-operatively that we would want you to immediately call us on would be if you had any fever. So if you develop any fever greater than 101, you would need to give us a call. If you're starting to have severe pain on one side versus the other, please give us a call. Now, it is normal with all breast surgeries to have some pain and discomfort, especially around the nipple and around the lateral part of the breast. And the reason that occurs is that's where the nerves are located. And nerves in those areas at first feel deadened, and so you don't feel anything, so it kind of feels numb. But over time, those nerves, quote unquote, wake up. And as they wake up, you'll feel kind of some burning pain in that area, and it will just feel kind of awkward. Sometimes it feels shooting pain, lightning pain. Those are all normal pains to occur when you're healing from a breast surgery. The last thing is the supportive garments that we'll talk to you about and we'll encourage you to wear. It's very important that you wear supportive garments, and those are good compression garments for the breast area after the surgery. We normally recommend that you do wear those for the first 6 weeks. So if you follow our instructions, and you feel free to ask us if there's any questions, but I just wanted you to know that that protein diet's super important. Wearing the compression garments, super important. And there always will be these little tinges of pain, sometimes feeling numbness. Those things are as well just par for the course. You will feel it. The last thing that I would bring up that would be super important to notify, it's generally less than 1%. But if you see nipple discoloration, so if you see that the nipple is turning a dark color or a black color, that would be something that you'd want to call us immediately on, because that would mean that you're not maybe getting enough blood flow to the nipple. And so please call us on that if you have any concerns in regards to that.